Hey guys, present day Kasey here, or future day Kasey, if we're talking in terms of the video that you're about to watch. I have a little notebook here because I just had a couple of things. I was editing the video and I had a couple of things that I wanted to say in regards to my nose. I look like I'm standing here like a newsreader because it has been quite a while since I filmed that video and I look a little bit different now. It's a little bit of a disclaimer. But I just feel like I need to explain like why I hadn't put that video up for so long and why it's going up now. So for starters, I feel like it was such an in-depth and informative video that I didn't want to waste the footage, and that's why I'm putting it up now. But it took so long. It's been a year and a half since I had my nose job. I had it in May 2021 and it is currently November 2022. It's been an entire year since I filmed that video. I didn't realize that much time had gone past, and the reason why I didn't realize is because I have no concept of time, and why I didn't edit it is because I have ADHD, and around the time of filming that video, I either got diagnosed just after or just before, and so it has just been a very big whirlwind of emotions and just learning and trying different medications and different things that work for me. So yeah, that's a big explanation as to why it is so difficult for me to stick to anything and upload frequently here on YouTube. So I just really wanted to explain that for just all my followers that come over from Instagram to watch the videos, or everyone that's subscribed to me and has been around for a while, or if you're coming from the nose job vlog and you're like, why the hell is this saying 6 months when it has been very longer? So I've lost a little bit of weight since then, which I feel like I don't need to justify this to anyone, but looking back on the footage, I was like, well, my face is a lot rounder. So I have lost a little bit of weight, and I also had my masseters injected with Botox, so they're like a lot smaller now too. So I just wanted to mention that because I feel like the roundness and puffiness of my face could easily be confused for like fillers, or because like I did mention that in the video, or just like swelling from the surgery in general compared to now, and it's not. I haven't had filler, I would say, for 2 years. I haven't had any filler in my face. And then there was a few other things I noticed while filming the video that I just wanted to give like a bit of an update on. This stuff won't make as much sense until you watch the rest of the video, and it is very long, but I just wanted to give like a bit of an update because it has been so long. So what I noticed when filming the video is that my top lip wasn't moving as much as it typically does. So I think it still was like a little bit stiff from the surgery, and because I couldn't go I couldn't really like rub my lips together like I can now, I think it was still a little bit stiff. So that has like loosened up a lot. I still tape my nose every single night because I notice if I don't, I still get a little bit of swelling in the morning, and I just like how refined it looks. So I still do that. And I do notice that if I'm drinking alcohol or if I am flying on a plane, that it will swell up and it'll be a little bit puffier for a few days. So yeah, aside from that, I don't have any like major swelling anymore. I do have like a slight lump of swelling here, and I can feel it if I squeeze the tip of my nose a tiny little bit, but the rest of the swelling is gone. It's just like in the tip of my nose. So this is pretty much what my nose is going to look like. The other thing is that I can scrunch my nose and it looks natural now. So I couldn't really like do that before, and I didn't really get like the little lines and stuff, and I mentioned that I was like a little bit scared to do that in the video. But yeah, obviously like that stiffness has like completely gone now. I can rub my lips. There's also no numbness in the tip of my nose. It still, I will say it still feels far away. Like when I touch it, I think I can tell that I'm touching swelling and not like my cartilage, if that makes sense. And yeah, anyway, I just wanted to mention that stuff, kind of explain. Hope that you guys enjoy the video. What's up guys, welcome back. So today's video is my 6-month rhinoplasty update. I'm looking down because I have a whole notebook of notes to talk through on this video today. Basically, I'm just going to go through all your questions. I asked on Instagram for questions about my nose job, and I also had some things I wanted to touch on myself. I'm going to touch on the physical aspect of the recovery and the experience, the mental aspect and how I'm feeling about things, and then also give you some information on my doctor. But just remember that I do have my video about why I wanted to get one and my nose job vlog, and both of those go into a little bit more detail on those things that I will leave down below. The surgeon that I went to who did my nose is Dr. Zachariah. He is located in Double Bay, and I went to the Sydney Day Hospital to have my surgery done, and they were lovely there. I'm gonna jump into the get ready with me portion of this video and all the questions and everything else that you want to know. Just wanted to give that little backstory. I really hope that you guys will like this one, and please keep watching. I'm gonna start off with like the physical side of things because I feel like that's where the bulk of the questions were relating to. So first one is, how long did it take obvious swelling to go down? So I think it was probably about a month to 6 weeks, like 4 to 6 weeks was like the majority of like the obvious kind of swelling from like the surgery. I'm still swollen now, like it takes a really long time for swelling to go down, but I do think the bulk of it was kind of gone by that like monthish mark. I think that's when I updated you guys in my nose job vlog, because I added like a little bit onto the end of it. If you haven't seen my vlog, I'll link it down below, but I did add a little check-in at the end of that. That was probably about a month, I can't remember. And you can see then that there was a really big difference between the initial swelling the day that I got the cast off and then the swelling that had subsided since then. And now that I'm like 6 months post-op, I feel there's like a really big difference in the swelling like now as opposed to like what it was then. Next question is, did I need any cartilage out of my ear? So I think that's like referring to, did I need like a cartilage graft? In some rhinoplasty or like septoplasty cases, they take cartilage from your ear if you need like structural shaping, rebuilding, that sort of thing. I had a very structural nose, so no, I didn't need any cartilage taken out of anywhere else. I'm not sure if he put a little graft in the tip or anything. I just had a rhinoplasty. I didn't have a septoplasty. I didn't have anything wrong with like my breathing. My septum wasn't deviated, nothing like that. So I had a closed rhinoplasty, which basically is just to do with whether they unflap your nose or if they just insert the things without unflapping your nose. And then the things we corrected was like I had a little bump on my nose, and I had like a bifid, not sure how to say it, tip. That's just where like the cartilage was separated rather than being together, so he just corrected that. So I'm not sure if they put any cartilage in there, but it wasn't from me because I didn't have any chunks missing out of my ears or anything. Alright, these questions are just like really hitting it off in the right direction. Next one is, do I get lots of snot now? I don't really remember how much snot I got before, but I feel like I just notice it a lot more now. So yes, I do get a lot of snot. I'm not as rough with my nose as I used to be. So I think I don't blow it as like vigorously and efficiently as I once did. I will say I get more crusty boogers. This is like delicious talking about this. I get more crusty boogers, like they're more dried and they're more really thin, like around the whole circumference of the inside of my nostril. Like when I had my old nose, I was like so rough with it because I was like, this is indestructible, this thing. It's like a cockroach. It's never going to die. Get my tissue, I'd make like a little twisty and get it right up there and dry my whole nose out. I just really don't like having a snotty nose, which I can't really do now, and I just don't really want to do. I'm like a lot more gentle. Things are still healing inside. One thing I have noticed is that I have a lot more blood in my boogers. I know this is so gross, but like these are the questions you guys wanted to know, so this is what you're getting. But there's just like a little bit more blood. Like I feel like my nose is just a bit more sensitive. I think like sometimes I put these little pinky nails up there. I probably shouldn't, but I love to pick my nose. I'm never going to be someone who doesn't pick your nose. If you say you don't pick your nose, you're a liar. I don't believe you. It's the most satisfying thing in this world. It's my favorite pastime. I have my fingers up my nose all day long. So does my sister. It's a family trait. Or if I blow my nose in the mornings, sometimes there might be a little bit of blood. Sometimes they won't. It's not enough to have like a bleeding nose. It'll just be like, it looks fresh, you know what I mean? And then it's gone. So I never have like an actual bleeding nose. It's more just like, maybe I've bumped it a little bit during the night, or maybe I've just bumped a little blood vessel and like while while digging for gold up in there. How did you deal with breathing during recovery? That's probably the most frustrating part of recovery. I had a really, really easy recovery. I didn't get black eyes or anything. The only like slight part of like bruising that I got was like under one eye. I can't remember which eye it was, but it was just one, and it was just kind of like red, like broken blood vessels. And yeah, I also had like really swollen eyes, but they were swollen for like a day. Like the second day was my worst day, and that was the only one that I noticed that I had like a bit of a black eye coming. I wasn't like too uncomfortable or anything like that. It was really just the breathing side of things that is like the most irritating and annoying. Mainly like the sleeping side, because you have to sleep on your back and you have to sleep like upright. It's like basically sitting, which I'm a face sleeper. I sleep on my front with like my face turned to the side, which is like so bad. It kind of just feels like for that week of recovery with like the breathing terms of things, it kind of just feels like you have a cold. Like you're just got a blocked up stuffy nose. You just feel like a bit fatigued, and it's just bothersome. It's just a bit annoying. Like that's all it is. I didn't have any pain or anything. Breathing wasn't particularly an issue. It was just a little bit annoying. When I was awake, it wasn't as infuriating. It was honestly the splints. That's the worst part. The cast is whatever, that's fine. The splints, like the cast is a bit that goes over top of your nose. The splints are like the silicone, like circular things that go up your nose. And basically they hold your nose in place. They keep everything where it needs to be so it heals correctly. It doesn't heal like asymmetrical. They hold your nostrils open so you can breathe. Splints are so long. Like I don't know how they fit in my nose. They must have been like up there. I don't even know. I think they go to like up here, surely. They weren't painful, but I could just feel a little tiny tickle, and it wasn't my favorite thing. Like you feel it come out and it pops out of your nose, and you're like, how does that fit in there? It is humongous, but it's so satisfying, and like, oh my God, the relief when you can breathe. Like, I just felt, oh my God, that was amazing. That was the best day of my life. The breathing and like the block side of the nose and like the stuffiness, that's definitely like the worst part of recovery, and it's really not even that bad. I had a very, very easy recovery, and I'm so grateful for it, but yeah. That's probably just like the most frustrating part. I tell you, when those splints come out, everyone always asks me if that was painful. The best feeling. I felt no pain. They did spray like a some kind of numbing sort of thing up my nose, which I wish I didn't even get that. I would rather feel pain than the commencement of like the numbing carpet freshener taste that was in the back of my throat after that. Or it kind of like, it numbs the back of your throat as well, because obviously it drips down after they spray it in. It tasted like someone had just sprayed air freshener, like carpet refreshener or something, into my mouth, and it was the most foul thing. That was the worst part of my recovery. That was the worst part. Next question is, how long do you need to keep taping? So taping, it depends on your doctor, whether like they like you to tape. Some doctors prefer that you heal naturally. I basically taped for 6 weeks. That's like what's recommended and what my doctor wanted me to do. However, I have kept taping past that point. I have this micropore tape. You can get a skin colored one, or you can get a white one. I've just got the white one at the moment. Basically, you just cut off little strips and you tape 1, 2, 3 just down the bridge of your nose, and then you do another U-shaped one and tape it upwards to lift the nose, and you wear that to bed every night. So that's what I did for the first 6 weeks, and then I would put my cast on top of that, which you're able to like remold due to like the silicone kind of stuff it's made out of. I had such a difficulty with that. I could not for the life of me get it to stick on my freaking nose. I don't know why. It would either be too tight or it would fall off. Like I don't know. That was like the toughest thing. I ended up just taping it onto my nose because I could not get it to stick. I don't know how people were doing it. I asked my doctor if it was okay if I could keep taping or if I had to stop, and they just said most people, like a lot of their patients, like to tape for up to 3 to 4 months. And I was like, okay, sick, because I actually love how my nose looks better when I've taped it the night previously. Because I do notice that my nose is like a lot more refined when I do tape. So the other day I didn't tape because I just forgot to do it before bed and I couldn't be bothered. And my nose was like a little bit more swollen the next day. It's just like it'll just be like a little bit more rounder and not as refined. Basically what the tape does is it holds the swelling overnight, because you're laying down, all like your lymph and your nodes and shit are like you're laying down like this, sleeping away, and everything, it's all swelling to your head. I don't know how to describe it, but you know how you wake up puffy in the morning? Basically, the tape prevents you from waking up as puffy with your nose as you would without it. It just helps prevent the swelling. I don't know how to describe it. I'm not a doctor, but I really, really like it. I personally can't see myself stopping taping anytime soon. I'm going to ask my doctor what his opinion is of it when I see him soon, but I don't think he'll have an issue with it, and I just don't see it being harmful at all. I love doing it. The only annoying thing about taping is that you have to use an oil to take it off every morning, and that is so tedious and so frustrating, but I'm happy to do it because I work from home and it's just so not an issue. Can imagine if you don't work from home, it will just add a little bit too much time to like your morning routine unless you got up hella early. It's not like it takes a long amount of time. It's just like you can't just like jump straight in the shower. You got to get it off because once that tape gets wet, it is hella sticky and it's not coming off your nose. So the next question is, how has my rhinoplasty altered my breathing? So I obviously just touched on how it affected my breathing like during the recovery, but in terms of how it's affected my breathing post-op, I didn't get my rhinoplasty for any kind of breathing difficulties. I didn't need any septum work. I didn't have a deviated septum. Everything was fine with my nose internally, structural wise. I purely got one for cosmetic reasons. So it hasn't affected my breathing at all. My nose is probably a little bit more stuffy more often than it used to be. Like it's not as clear. There's a lot that's been done, you know what I mean? Like there's little bumps and things in my nose that didn't used to be there, like scar tissue, I guess, because things are still healing. Like it has only been 6 months, and it can take up to a year to 2 years for like full refinement and healing of your nose. It's a very delicate and like long process. I think that's why I have like a little bit more boogers and things. There's probably just like little scabs and like different nooks and crannies and bumps. I kind of always feel like I've got boogers in there, even though I don't. Like kind of up here, nostrils feel a little bit smaller. Like we didn't actually change the size of them or anything, but I think they just feel a little bit more narrow than they used to. Honestly, not even a big issue. I barely even notice it. It's more just like when you have like allergies and your nose is like slightly a bit stuffy. And I think that's just due to having a surgery. What is necessary in your hospital bag? That makes it sound like I'm going into labor having a baby. I really don't think anything is necessary. I'm going to do my eyebrows. A change of clothes. That's it. Change of clothes, maybe some snacks if you don't like the snacks they have to offer at the day hospital. Personally, that was my favorite part. They gave me a popper, like a little juice popper. I was so excited. And then I had some crackers or something. I'm not sure. I was so out of it. I barely remember now. I was like just so stomped to be out of surgery. It's just a really exciting time. I will say that was a very positive experience for me. Surgery was awesome. Getting the snacks afterwards, I was like living. I love being taken care of. Maybe I'll have like Munchausen's when I'm older. Not to joke about it, but like I low-key love being taken care of. Like I don't like being sick or having things wrong with me, but I love like when I'm baby and I'm like, can I have some soup? Like that's like my favorite thing. So them giving me like juice poppers and like little snacks and crackers and things is like so exhilarating. But if you want to bring your own snacks, you know, bring some snacks in. They kind of just look after you and give you everything that you need. It really just depends like if you're staying close by or if you're heading back home. I live about an hour and a half away from where my day surgery was. Sorry, my eyes like glazing over because I'm just trying to reshape my face. I didn't really pack anything because like I was just going straight home anyway. You're not going to be like that hungry after surgery. You'll probably just want like a drink because your mouth might be a little bit dry. When I woke up, I really felt fine. I probably felt a little bit faint for like a minute tops. I was like really, really, really fine. I didn't have like an adverse reaction to the anesthesia or anything like that. It was honestly just like a really cruisy, easy experience. I was talking to the nurse about how I'm a sun sneezer and we discovered that he is also a sun sneezer. So that was really exciting. And they were just like so lovely and accommodating to my unhinged questions. Yeah, I personally didn't need anything in the hospital other than a change of clothes. Just make sure you've got something like easy to get over your head, like preferably something button up or jammies or like a robe. I just took like a jumper that was really easy to get over my head because I just didn't really give a shit. I just wore clothes there that I was going to wear out. I didn't take a hospital bag or anything. Like they gave me a bag to put my clothes in. Obviously you keep like your undies and bra on or whatever when you change into your little hospital gown. You get to have your phone up until you're going into surgery, then they just like pop it under your bed for you. This is a funny one. Do you have a funky smell inside your nose? And they were like, be honest, which I thought was really funny because I actually do have a funky smell in there. It's so gross. It's so gross. So if I like scratch the inside of my nose, just so that we're like, because basically this is where they would have made the incision, right on the inside of like my septum in there, and then they would have somehow slid the instruments in through those like little incisions. And so right here where the incision sites were, I had like sutures all up in here. Where those sutures were, if I scratch there, right, it smells so gross. Oh my god, it smells as if you've been wearing a Band-Aid for a long period of time and the Band-Aid's gotten wet in the shower, and then you take it off and say it's like your finger or something. I don't just go around smelling my Band-Aid sites, but like your finger, and you go to scratch or something and you're like, oh, where my Band-Aid was kind of smells a bit funky. Like it's just a slight musty smell, like nothing to be alarmed about. It's not like an infection, but it just smells like a bit, oh, you've had a Band-Aid on for a little bit. That's what it smells like. And so that's the kind of smell I have right in here. Like, and I only notice it when I pick my nose, or if I'm like, if I focus my scent in that. I'm unhinged. I know, I'm insane. Just smells like soggy skin. I've Googled it, as you do with everything. And some people were saying like if they used like, I can't remember what the word is, like fake scab. Artificial scab, is that it? If they use something like that in there, maybe you can have a little smell. So I was just thinking, I think the skin's still just healing in there. Like there's still a lot of stuff going on. And like it's really not that noticeable. It's just noticeable because I am very highly aware of these things, which is so weird. But I'm just like, Hamish always says that I have the most descriptive medical explanations for like when I go, like they're not medical explanations, but I have the most descriptive issues when I go to the doctor. He's like, I don't need to know that, like you're going into too much detail. I'm like, no, but I have to describe exactly, like it's on the inside of my brain, but it's not in my brain, it's like my eyebrow. Anyway, that's the only little stank smell I have going on. It's really not a big deal. Don't worry about me. My nose isn't gonna fall off. How long did it take for your nose to settle into the rest of your face? So every day it's like a little bit different, but I will say like the first week of like having my cast off and like that first kind of month, it kind of just looked like, it didn't look like I had someone else's nose, but it kind of did. I'd look at my face and I was like, this is so weird. Like I was just getting used to my new face, I guess. So yeah, I feel like now, like at the 6-month mark, I feel like it really like suits me. Like my hairdresser was saying the other day, like I look so different, but it suits me so much and it still looks like me. All my family have kind of said that as well. Like they say like it still looks like me, which is what I wanted. I wanted to look like myself, but I still wanted to look like a different nose because obviously I just really didn't like much about my old nose. So yeah, it was probably like around the 4-month mark that it started to like really settle. Up until then, like the swelling was like not bad, but it was just like obviously a lot more noticeable. Whereas now, like, it's just so settled. So I would say around then. There wasn't really a time that I felt like it didn't look like my nose, like it didn't look like me. It's just over time, it's kind of just the swelling's gone down, looks a bit more natural. One of the things that I did notice with my nose was like it was quite a bit stiffer when there was more swelling. So now I can like kind of like scrunch my nose a little bit more. I haven't really tried to do it too much, like that's the most I'll scrunch it, but like when I do it now, I kind of get like the little wrinkles back on my nose, so it's starting to look a lot more natural and more settled in my face, whereas like before I could not even slightly wrinkle my nose, and it was really stiff. So the next one is, did you use any dry mouth / nose spray? So I didn't use anything for my mouth. It said like dry mouth sprays. I don't even know what a dry mouth spray is. If it is a thing, I probably should have done something like that because I honestly get a really dry mouth as it is. And people on Instagram, I mean, just one person really they used to bully me. This one girl, she's so unhinged. She was like, yuck, your mouth makes the grossest noises. Like would write like troll messages to me like that saying how like gross and disgusting my mouth was. Like she would say that my mouth had too much saliva or something, and I was like, I'm sorry, I apologize. Like, but I used nose spray. So my surgeon and the clinic, Watson, please don't start smudging. He's smudging his feet, guys. I'm really sorry for the creepy dog ASMR. Okay, that's a bit much. He starts getting so like vigorously into it that he starts snorting. It's like a lot. We're gonna get him his needle soon for his allergies. Throughout my recovery, I was told to use the Fess nasal spray. I also had a medicated spray that I had to use for like the first week, and then after that I didn't use it anymore because I wasn't supposed to, so I stopped. But the Fess I had to keep using the entire time, and basically that was to try and keep the silicone splints clear because they would fill up with mucus really easily, so it would just like help relieve it so much. Basically just like cleared it out, and it was like a lifesaver. And then aside from that, I used the Flow nasal wash, which is like a little sachet. You pour it in with like lukewarm boiled water, so you boil your water and then let it cool down, put it to your nose and squeeze gently, and the water just flows through your nose and clears everything out. So that was really good, but I could only do that once the splints were taken out, because I think I probably would have like drowned if I tried to do it with the splints in. Obviously, like, your doctor will recommend you what they personally want you to use, and I wouldn't use anything unless it's cleared by your surgeon and the nurses at the clinic. Watson, please. Did I have any unexpected side effects? So I did. In my vlog, I showed you guys that I had, like, my nostrils were a little bit uneven. I had to like watch my vlog back before filming this to just see if there was anything, because I honestly couldn't remember. I had slightly uneven nostrils, and it was literally just because one of the sutures was a little bit inflamed, and it was like kind of tugging my nose inwards. So I guess that was a slightly unexpected side effect, but also I wasn't like super alarmed or anything, because I did ask my nurse when I had one of my checkups. I was just like, what's up with this? And she was like, it's inflamed, yo. It's nothing to stress about. And they just gave me this stuff called Clawsig, which I think is meant to be used for like pink eye, things like that. And I was just told to put that up my nose and just like on the little inflamed area. And that helped so much. Cleared it up pretty much within a week. And yeah, it wasn't like an infection or anything. It was just slightly inflamed and a little bit tender. Probably like the only major thing that I was concerned about, and it wasn't even major. I more just like wanted to make sure it wasn't going to cause like long-term asymmetry or anything like that. But as you guys can see now, like, my nostrils are pretty symmetrical. I mean, they're my original nostrils, my natural born nostrils. That was one thing. The other thing was my lip was like stiff, and the tip of my nose was really stiff, and I couldn't go like this. Like, I still, like, now I can touch my lips together. At first I couldn't do that, and I can't, before I had like a droopy tip, so when I would smile or when I would go like this, my tip would droop down. Now it's like more structurally sound and held in place, and we changed the angle of it, so it just doesn't it looks so weird doing this, but it just doesn't move like it used to, and I can still feel a bit of like, not tension, but it's just a bit more up there. So that was like one thing. The tip of my nose, like, I'm still getting feeling back. It's still a little bit numb because the tip is like one of the places that takes the longest to heal. Because my nose was so stiff here, it made like my lip kind of stiff, like, and that went away pretty much as soon as I got my cast off and the splints out. Probably within a couple of days, like, the movement came back, but at first I was like, I kind of felt like I was like this. Like, it was just kind of stuck there. It was really funny. Yeah, that was like the only major things. I did write down here as well that it affected my talking with the cast on, which is because I could feel the splints in my nose. So for like the first few days when my nose was a little bit more tender, I didn't take the painkillers for very long, but those were the only times that I did, like those first like 3 days. And I just tried to not talk too much, because when I talk, obviously things move around, and then my mouth is like this, and because it's being pulled down so much, I just felt when I tried to talk, I would be trying to put my lip over my teeth when I'm talking, as you normally do when you say certain words, and it would just slightly tug on the splints, and I would feel them move at the top of my nose, or I'd feel them move in here where they were sutured to my nose as it was like healing, and it would just kind of sting the teeniest little bit. It really wasn't painful. It was just like a little bit irritating and annoying. So I just tried to not talk too much. And it was a little bit more difficult to talk because I had to kind of keep my mouth, like, not keep it, but it was just held there from the cast. So basically just like my face wasn't able to move as naturally as it once did. So those are probably like the most unexpected side effects, and they weren't even that unexpected because they're just so not even a big deal at all. I did want to touch on as well, I just realized this wasn't asked. It was like asked initially when I first like had my rhinoplasty and stuff done, and I've answered it before. But I wanted to add in, because this was a little bit unexpected, about glasses. So if you guys didn't know, I wear glasses. I don't wear them when I film, because obviously like they would reflect the light and it's just super annoying. I'm short-sighted, so I basically need to wear them all the time. My eyesight's not awful, but I feel a lot more confident and comfortable when I have glasses in. And I always wear contacts when I film. But when you get a rhinoplasty, they give you like a little kind of booklet sheet of like facts of like what to and not to do after your surgery. Mine said I couldn't wear glasses for 6 weeks, I think it was, post-op. For that whole first week of recovery, I didn't wear contacts. Like I was not going to bother with that. I just wasn't sure how I was going to go getting them in and out of my eyes while having a cast on. I just thought it might be a bit in the way and a bit annoying. So I just wore my glasses like when I was watching TV and stuff. And if you want to wear them, you have to tape them to your head. So I would just kind of tape them a little bit higher, like just so they're not sitting on your nose. Anyway, you can just have them not sitting on your nose and tape them to your face. It's basically what they recommend. And then as soon as I could wear contact lenses again, I started wearing them. And I when I tell you I have not worn glasses since, I mean, I've probably worn glasses like 5 times in the 6 months since having my rhinoplasty, and that is simply just because it is so annoying. I did not expect to hate wearing glasses. I thought like I wouldn't care. I thought my nose would look so much cuter. I hate wearing glasses so much. I find it so uncomfortable, which is like, I really did not expect that coming into this, I guess. And I guess it's just something that I want you guys to know, because if you are someone that has to wear glasses and you don't have the luxury of wearing contacts. Also, another thing is I like to contour my nose now, which I used to try and contour it and it just never looked good. And now I'm like obsessed with contouring it. I think it's so cute. Next question is, were you scared to blow your nose? So no, not really. Like when I got the splints out, I couldn't really blow my nose because I still had the cast on. So I think the first time I blew my nose was like when the cast and everything was off. And I just kind of blew it really gentle, and I was like, oh. That first week it was very tender still, because it's just come out of a cast, it's just exposed to the world, and it's fresh. She's fresh as fuck, and she's not ready to be touched too much just yet. So I was like a little bit nervous, I guess, but I wasn't scared, I would say. And it really like wasn't that bad. Mainly when I blow my nose is like first thing in the morning when I hop in the shower. I just kind of let the shower steam kind of like loosen everything up, and that's when I'll blow my nose. I feel like most people, when you blow your nose, you're like you cover one side and push out. I never do that to my nose anymore. I really gently just kind of close my nostril. I don't want to touch it because I don't want to get makeup off, but I just kind of close my nostril and then a little bit. I don't fully push on the side of my nose, if that makes sense. So I'm like just a lot more gentle with it than I used to be. Last question of like the physical side of things before we move on to like the mental kind of stuff is realistic recovery time, example, getting back to work. So for me, I feel like I felt the most ready to like work and go back to like my normal kind of life maybe like a week and a half. If you work from home, I would say you definitely can work while you have the cast on. If you have a recovery as easy as mine was just a really simple, breezy recovery. If you have like a little bit more of an intense recovery, maybe just like allow yourself like 2 weeks off work. So that would include the entire week or so of recovery, like with the cast on. I think I had my cast on for about 9 to 10 days. I found like another week after having my cast off was like when like the last little part of bruising that was on my nose kind of went down, and when that last little bit of swelling from like the initial surgery was kind of like gone. I'm going to flip the page and we're going to get on to like more the mental side of things. So the first one is, how do you feel overall? I love my nose job. I should have started the video with this, but I feel like most people wanted to know about like the physical side effects and all that sort of stuff, like my boogers. Yeah, I feel really, really good. I honestly love it. I feel so like happy with my nose. I used to just notice my nose in such a negative way. It was such like a hindrance to my life. It felt like such a burden, which I know sounds so dramatic, but it just was the focus. It was the main character of my life. I felt like I was defined by having a big nose. I felt like it just didn't suit me. I'm only 5 foot, so I'm really small. I felt like my nose just looked really big on like my little face and my little frame. Like it just didn't suit the rest of my body, I felt like. And I just felt like I wasn't living like my hot girl summer life. And now that I've had my nose job, I feel like my nose fits my face. I feel like my face looks so much softer. Like it's actually crazy when I look back on before and after images of like the composition of the rest of my face. I have kind of changed my whole opinion on getting like fillers and stuff now. Like I still love that stuff and I'm like still totally for it, but I just don't feel like I need it as much anymore. Like don't get me wrong, maybe I'll still want to do it one day. Like I'm still gonna do my Botox. Just like having like lip filler and cheek filler and all that sort of stuff, I just don't feel like my face needs it as much now. Maybe because my nose was a lot more pointy and prominent, I was trying to make everything else kind of blend in with my nose a little bit more, when in reality I think all I really needed to do was have a nose job, and I probably wouldn't have ever got any other filler. Who knows? We can't really sit here and talk about what ifs and go back in time, but I just think it's really interesting to think about like just how much it actually has changed my face. My face looks so much more soft. I felt like I had a really harsh kind of face before because my nose was so like pointy and kind of prominent and skinny. Like I had a very skinny, slim, kind of bony looking nose, and now my nose is just like, if I catch it in like the mirror, I'm like, oh, that's a cute little nose. Overall, obsessed, thriving, living my best life. So happy with my nose. Next one is, did you ever have doubts about the surgery? No. Sounds ridiculous. I'm usually like the most anxious, worried person, but I kind of have like this false sense of like, it's not gonna happen to me. As much as I'll like worry about things and get anxious, I don't know, I'm just weirdly like give no fucks, and I just like really jump into things. I don't know, I don't really think about like the outcome of it. I'm not sure. That sounds so terrible, but yeah, that's just really how I am with a lot of things. It's like kind of ridiculous. So yeah, like as soon as I booked it, I like was not nervous for the surgery at all. I was more nervous about being put under, but even that I wasn't nervous about. If you guys don't know, I'm on SSRIs, which are serotonin, I always get this wrong, SSRIs, fucking something. It's for depression and anxiety, and I've probably been on them for about the past 2 years now, I think. Maybe a little bit more, I'm not even sure, but Watson just made a loud moan. Are you comfy, Bobby? Basically, they have like changed my life, and I'm so like not as reactive as I used to be. I used to be very reactive and would get upset and like triggered just very easily. So yeah, I mean, I could do a whole other video on those, and like I've been meaning to. If you guys want me to talk about like my mental health journey and stuff, I'm totally happy to, because I'm really open with it. I feel like ever since I started those, I just like have not been as scared of things as I usually am. Like I had to have a blood test before going in for surgery, because they just had to make sure everything was fine, and I also had to get an iron infusion. I had it like a few months prior to surgery. Not related to the surgery, I just have really low iron, and I had to have my iron stores topped up, and so I was like dreading that blood test, but I did it. It was my first blood test in like literally like 10 years, I'm not kidding. I had that much of a phobia of it, and I had it and I was like, that was the worst, but it was also kind of fine. And then when I had to lay there getting my infusion for like half an hour, I was like, this is the worst, but it's also kind of fine. And I feel like I overcame my phobia, and I feel like it was all because of being on my medication. Because it's just, I don't know, it just stops me from catastrophizing every single situation. Like once I started it, and I was probably like a year or so in, that was the only time that I even considered like going and finally getting my bloods checked. And like before that, I was really scared of surgery. Like I didn't even consider having a nose job before. Like I always wanted one, but I just didn't think it was something I would ever do because I was so scared of being put under anesthesia. And then after being on my SSRIs for so long now, I don't know, just like finally one day I just felt like, YOLO, I'm gonna do it. And I don't know, I just wasn't scared anymore. I don't know, medication, man, really be doing that shit. Like since I actually decided like to get a nose job, started looking into it properly, researching it, it's like taking action to get one, I have not been nervous about the surgery. I initially started looking into it like a year or so prior to actually getting it done. When I first looked at it, I was watching the videos and I was like, ooh, like, I was like, that can't be me. I was scared to be put under and stuff, but I feel like once I had my blood test, my iron infusion, I was kind of like, this is a breeze, this is easy. And even when I was about to go under, like when I was waiting in the hospital to go in for the surgery, I was so chill, was not anxious at all. I was more just like anxious because I was like, I want to get this done. I was like excited. And then yeah, when we were about to go under, I was like, oh, I'm just like a little bit funny with needles. And Dr. Zach just held my hand, and the guy, the anesthetist, I can never say anesthetist, he just said, we're going to give you a cocktail now. And then I was asleep. That was it. And it was the most pleasant thing. It was literally a tiny little sting. The most euphoric feeling when I woke up. I was like, I just felt happy. It just felt nice. I actually kind of liked being put under. It was pleasant. I just had a really positive surgery experience. Like, obviously it's not going to be like that for everyone. And I don't want everyone to think that it's like some small, easy, like risk-free kind of thing, because it obviously isn't. But yeah, for me, it was just, I had no worries. Do you wish anything was different, or do you love it completely? So do I wish anything was different about my nose? No. Sometimes I'm like, should I have got it a bit more swoopy? But not because I look at it and think it's not swoopy enough. Like, I think if I went any smaller, I would have no nose. I'm actually shocked at like how minimal of what we did has such a big impact on my face. Like, all we did was we just removed the bump. He didn't even really like make it like super swoopy, because I didn't want that. I wanted it a little bit more straight. I just didn't think a swoopy nose would really suit me too much. And I think it has like enough of a little swoop to be cute. But if that were to go away as the swelling goes down over the years, I really don't care. I'm just really happy with how symmetrical and straight it is. My biggest thing was my bump. I hated my bump so much, and the tip was like, that really started to bother me as I got older. It's just so crooked. My nose was like a crooked mess. It looked like I'd broken it. And I used to get questions like if I'd ever broken my nose. And I was like, no, I haven't. It's just looks like this. When we took the cast off, I was like kind of shocked at how small it was. And it was like, they're like, it's just gonna like keep getting smaller and more refined. I still look at it, I'm like, how is it going to be any smaller in like 6 months time? Like, I don't get it. So yeah, that's the only thing I ever think of, is like maybe a bit more of like a swoop would have been cute, but I just don't think that would have suited my face. And then the only other thing is just like, I want the last part of swelling to go down. But aside from that, I literally love my nose. I have no issues with it. It's just the last part of the swelling that I would really love to go down. But I don't think I would change anything. I wouldn't get more of a swoop or anything like that, because I just feel like it would be a little bit too much. I did want my nose to look a little bit more natural and still like me. Next question is, were you scared it might not turn out how you want? Which kind of relates to the last two a little bit, but honestly, no, I was not scared. I feel like I kind of prepared myself for the worst. So the whole time my cast was on, I was just kind of, I don't know what I was picturing. I wasn't really picturing much of anything. I don't think I had any kind of expectation of what my nose would look like, other than the images that Dr. Zachariah made up for me. I sent through photos, and then he edited them on his computer and showed me of like what my nose job could look like, possibly. Sorry, I look like I'm like crying right now because I just kind of choked on my own saliva. I'm not crying. He couldn't really show me too much from the front of what it would look like, but from the side is like literally exactly how it turned out. It's just insane like how good of a job he did. And like, I was hoping that it would look like that, but I don't think I had a specific like vision in mind of like what it was going to look like. I don't know. I kind of do this thing where I'm like just not even alive. Maybe it's like I dissociate or something. Like, I don't know. Half the time, half my life, I can't even remember what I was thinking at that time. Like, I was just existing. I think I was just going through the process of recovering and healing. I'm not even sure. I don't even know what to tell you. I think my expectations were just like so low, and like not low, but I think I was just extremely realistic. I just knew that it wasn't going to be exactly what I wanted it to be straight away. And I just expected it to be so swollen. And then when we took the cast off and it like, I was like, that's swollen? I was shocked when the cast came off. Whereas like, I know a lot of people, a friend in particular, they had their cast taken off and they were like, oh my God, like they nearly cried. And so many people do that. They get upset because it's not what they expected. So I think I was just really lucky to have very realistic and low expectations. I think I also just was happy to have anything other than my old nose. And I was very aware that it was going to be extremely swollen and then it's going to go down in time, and that I just thought anything would look better than what I had. So I was a fluke, honestly. I think I was probably one of their best patients they've had, because I was like fucking so easy breezy, so stoked. I don't think they're particularly used to that reaction. I was like nearly crying tears of happiness when the cast came off, not tears of sadness. So I'm just going to answer one more before I go and like do my hair, and then I'll come back and answer the rest of them, just because I have finished doing my makeup. How many weeks did you wait to go out again / when did you feel comfortable leaving the house? So I think I had to leave the house a few times to go up to Sydney for appointments, but I just got lifts with like either Hamish or my parents, and I would go up and I would go out in public. Like there was a time that we went to a cafe while we were waiting for my appointment to get my splints taken out, and I sat at the cafe with my nose thing on. I didn't really care, but I didn't particularly go anywhere like around the area that I live with my cast on. I just like didn't really want to have people staring at my nose. But the day that I got my cast off, I like was like stoked. I like pretty much went out straight away. Like I don't think I went out that day because we were at home and Hamish's parents were visiting, but the next day I'm pretty sure I went out with my sister and showed her my nose straight away, and I think we went to the shops. So pretty much like straight away I felt comfortable to go out because I was just like super excited. Do keep in mind that I had a very easy recovery. If you want to see my recovery, go and check out my vlog. It's not what most people have. I just got extremely lucky. I just went and did my hair. I don't know if I hate it or not. I think I hate it, not sure. The next one is, do you miss your old face? No, I don't miss it at all. Yeah, the only thing I miss about my old face is I used to be skinnier, but that has nothing to do with my nose. That's everything to do with my chocolate addiction and my cheesecake addiction and my McDonald's addiction. But yeah, that's nothing to do with my nose. In regards to my nose, I do not miss my old face at all. I didn't really have like an identity crisis or anything like that, and I think someone mentioned that in the questions. Oh yeah, so that was the second part of this question. I didn't even realize, but it said, do you miss your old face / do you find it hard to recognize yourself? But no, I haven't had like an identity crisis or anything like that. I thought I would, and I kept joking about how I would. The dogs are like fighting right now, if you can hear what's in a Winnie. And I was prepared. I was so prepared for it. I was ready to have a crisis. I wanted a crisis. I think I was just very aware of what I expected. It wasn't even that I expected the worst. I just was very aware of what to look out for, and what might be coming my way. And I don't know, I just didn't happen to have an issue with any of it. I think the closest I was to like having, like not recognizing my face was probably like the week that the cast came off. I think I just kept looking in the mirror like, what? Like even me looking in the viewfinder, because I haven't really been filming YouTube videos very often. I'm out of whack. I'm out of practice with filming YouTube videos, and looking at myself in the viewfinder, that is what's weird. And like when I go to sit down and edit a YouTube video, that is kind of weird, like seeing myself talk while on camera. It's different when like I'm just on my phone and filming like my Instagram reels and stuff, because I look at my face in the mirror all the time. I look at myself in photos when I'm editing them, and all that sort of stuff. But I don't know what it is on YouTube, seeing myself in live action. It's just a very different angle, and it's as if if you're seeing yourself from someone else's perspective almost. So that is like the only really weird thing that I've just been noticing now. And it's not even in a bad way. I'm like, oh, that's a cute nose. I think I was just very ready for it and very mentally mature enough to handle the weight of the decision of getting plastic surgery. I always wanted to have a nose job, even when I was younger, but I'm really glad that I waited until now. I think that is something to be really aware of when you are going to get like a rhinoplasty or any kind of plastic surgery, especially one that is so centered on your face. Like your nose is such a prominent part of your face, and it really does change your entire face when you get it done. Some people look so much like themselves. Me looking at myself, I'm like, holy shit, I look like a different person. Like to me, I feel like I look like a different person. The rest of my family think that I still look like me. And I think if I saw anyone that like I knew previously to having a nose job, or anyone from school for that matter, I think that they would still know it was me. But yeah, you guys can be the judge of that. Do I still look like me? Well, let me know. I'm very curious, because I think like I do, but I don't. It's really weird. So I think you really need to be prepared for that outcome, that you aren't going to look like yourself, or you're going to think that you don't look like yourself. And I guess it is like a little bit of an identity crisis. Like for me, it's a positive one. When I booked in my consultation and stuff, after like your appointment's booked and like it's all going ahead, they do make you see a psychologist to make sure that like you're in an okay headspace, because they obviously don't want anyone regretting the decision. It's such a big decision, it's so much money, and obviously like you need to make sure that you're sound of mind and it is something that you really want to go forward with. Next one is there anything you would do differently if you were to do it all again? Yeah, heaven forbid I have to do it again, but if I did, it's such an easy recovery that wouldn't even be phased. It would be annoying because I don't want to get another nose job. I like how it is now, so knock on wood that nothing happens with this little nose and everything continues to just go up and up. But no, I don't think there is anything that I would do differently. I'm really happy with my entire experience, my results, the outcome, and just everything that I went through with it. Like it was just such a good experience. I feel like I picked the perfect doctor for me. I feel like it was at the right time in my life. I was mentally mature enough and stable enough to move forward with this decision, and not have it negatively impact my life. Like it felt like I'd marinated with it for a very long time, and it just felt like it was the right time to do it. Like I've been wanting to do it since I was in high school. I just never thought that I would do it. I remember watching Bridalplasty, that show where all those brides that were getting married, they would have to like compete to get the surgeries of their dreams for their dream day. And I remember the girls getting rhinoplasties, and I was always just like, I want one of those. Like even when I was little, I always knew that I had a bump on my nose, and I always knew that I didn't like it. If you want to see more of like why I decided to get a rhinoplasty, I will link my video discussing that below. It just felt like something that I had always really wanted to do, but I was too scared to do it. And it wasn't until the last few years of my life where I started medication for anxiety that I finally felt capable enough to deal with that decision. And like I just felt like adult enough to make it. Do you know what I mean? I didn't feel like a kid anymore. I mean, I still feel like a kid 90% of the time, but I just felt like I was in the right headspace to do it. I felt I didn't feel like overwhelmed with the idea of doing it anymore. And that is a big thing for me. Like I can feel overwhelmed with decisions very, very easily. And I just felt capable of going through this, and yeah, it just felt like the right time. Advice for someone wanting a nose job: is it worth it to just do it now, or should you wait? I feel like this ties in with kind of what I just said. Personally think it's worth it to wait. If you're having any kind of doubts in your mind that you might want to wait a little bit longer, I would wait. It's not something that you should jump into. I feel like I was quite spontaneous with booking it. I feel like just one day I knew that I wanted to book it, and that's what I mean with spontaneous. Like for me, I'm the type of person that as soon as I want to do something and I 100% know I want to do it, I just book it and do it. But if I'm umming and ahhing and I'm like, oh, I don't know, and I just never get around to booking it, that is a big sign to me that it's just not the right decision right now. If it's truly something that you want to do, I feel like you make it happen. And I feel like I just needed that time over like the last 10 years to learn how to love myself without getting any work done. With my experience with fillers and Botox and a non-surgical rhinoplasty, I feel like I did try other avenues that weren't surgical. And at the end of the day, I think I just realized that a nose job was the right decision for me. Like that's truly what I wanted. I think it's really important to just wait until you're mature enough to handle the decision. It might seem like a great idea to go and get it when you're like 18, but I think it's really important to make sure that it is the right decision for you, that you're not doing it for anyone else. Don't do it just because other people are like, you have an ugly nose. Do it because it's truly what you want for yourself. I think you just really have to take the time to look inside yourself and decide whether it's the right decision for you. Like, learn how to love yourself the way that you are and your nose the way it is, and come to terms with the way that you look and accept the way you look. But at the end of the day, if you still want a nose job, I think that's when you know. Like, when you've tried every other avenue, I feel like that's when you know that it's the right decision for you. I don't know if that makes any sense. I don't want to sound like a hypocrite or anything like that. I just feel like I really went through the greater part of like my 20s, just discovering who I was. I mean, I still am every day, but I just feel like I'd really made peace with the way that I looked. And if I didn't get a nose job, no harm, no foul. Just felt like it was the right time to get one. I didn't feel pressure from anything online, from no one in my life. Like, I felt really free to make the decision for myself. I felt like in a financially stable place to do so. And I don't know, everything was just aligned and it felt like the right time. So I guess that's my biggest advice. I would just say, make sure it's the right time. It's not a decision to make just randomly. And if you do spontaneously decide one day you want one, at least take like a couple years to research it and look into it. When you know, you know. The last one in like the mental health side of things is any advice / tips / things you found helpful during recovery. The first one that just came to mind is getting like little ice packs that fit your face. Oh my God, I wish that I had like little tiny ones or something that I could sit on my nose, something really soft. I felt like I didn't really have anything like that. Later on in my recovery, I got sent like a recovery pack from this brand. I can't remember what they're called. It's something recovery. I'm going to link it down below because I think they're really great. And they do work closely with like the surgery that I went to. But by that time, because my recovery was so easy, I just didn't really need most of it, but it was so nice that they sent me one. But they sent me some gel eye patches that had the eyes cut out, and it's just like these gel beads, and you would just like sit it on. But most of my swelling was in my nose, so I didn't really need it for my eyes, but I could imagine that they would be really, really helpful if you're needing that. And maybe get like, I tried using like frozen peas, I tried using like ice blocks, like Super Dupers. I tried using ice packs. Nothing just fit around my nose the way it was meant to. So what I ended up using, my eyelashes are getting stuck together, just happened to be in my freezer from when I get my fillers, is they often freeze a glove full of water. So it's like a frozen hand. And I just still had one in there from like months and months ago. So I just ended up using that, and I would just like put the fingers like this around my nose. So that ended up being really helpful, but I would kind of advise to get something a little bit more squishy. I liked that one when it was melting, because then I could kind of mold it on my nose. Get good pillows for your bed, or sleep somewhere other than with your partner. Make sure your dogs are not home. I sent my dogs to my mum's house. I kept Winnie here like later on. I sent them both initially, and then Winnie came back because she's very gentle, and then Watson came back because he here in the face, and I did not want to have my nose knocked. And then the other thing is like, I am someone who gets so uncomfortable with my pillow when I'm in bed. I flip my pillow like 100 times a night. I'm not even kidding. Like, no word of a lie. I'm constantly uncomfortable with my pillows. I can never find the right pillow. Please, a pillow expert, just recommend me something good. But that's a really big tip, is get a really comfy pillow, get a really big plain pillow, or like those pregnancy ones or something to like prop you up. What did I end up doing? I wanted to sleep on my side. This is a little hack that I have, because you can't sleep on your side, you have to sleep on your back, right? So probably like the third or fourth night, I was like, I'm so sick of sleeping on my back. So I started laying on my side like this, and then I would put my travel pillow here, and then my other big pillows around me. So my head was stuck straight like this, but my body was on its side and still elevated upright. I don't know if that makes any sense. That was like my little hack of getting around sleeping like straight on my back, like just a way that I could move my body. I felt like I was gonna get bed sores if I laid on my back any longer. It seemed to work for me. Give it a go if you're having surgery. Might work. Make sure you have some easy meals in the fridge. That's one thing I wish I did more of. I bought a bunch of like yogurts and things like that, and like some yummy little snacks and stuff, like custard and things. But I wish that I'd bought, like I had soup, but I wish I'd bought some more like substantial kind of meals. Like my mum ended up coming over and making me like veggies, and she mashed them up, maybe like mashed potato and stuff. So I would say maybe make yourself like a bunch of mashed up veggies, like mash them with mashed potatoes, broccoli, carrots, all that sort of stuff, just so you're eating some kind of pureed food the first few days. It is a little bit more difficult to eat, and your lip will be kind of stiff. Soft food is like a lot easier, so yeah, just maybe meal prep like some squishy vegetables. If you ever have questions about it, just DM me on Instagram, and I'll do my best to get back to you. I'm not amazing at my DMs, but I do try. I just get overwhelmed very easily. I'm going to move on now to just a couple more questions before we finish. This is like for the doctor surgery side of things. The first one is, did you have consults with other doctors? So I actually had a consultation with one other surgeon. Initially, I was going to go with that one. I didn't think that I would have to shop around too much, which is very naive of me. But yeah, I booked that one at the start of, like, before lockdown happened, and then our first lockdown happened. I had to cancel that appointment, and then I don't know, I just like kept pushing it back. I don't know, I can't remember why. It just didn't feel like the right time to do it, so I waited until maybe like 6 months after. I think it ended up being like almost a year after booking that first appointment that I actually ended up going into the consultation, and I'd already paid the consultation like months and months prior, so it was all like ready to go. I just had to actually pick a date, and I just couldn't settle on one. I ended up going to that one, and I just really didn't vibe with him. I don't know, I just found him like a bit more old school. I didn't like the way that he did my nose in the edited images. Really didn't like it, and I felt like when I was trying to communicate with him about what I wanted, I was like, oh, can we like, because he made my nose very swoopy but didn't really edit the tip, so it looked like a nose from like Whoville. I'm not kidding, it looked like the Grinch. Like, it was really bad. I mean, it might not be bad for someone else, but I feel like it didn't suit my face. So I was like, oh, can we make it like less swoopy, like a bit more straight? And he's like, yeah, we can do that like during the surgery. And I was like, can we do it now? Like, I just felt like I wasn't really being listened to. I kind of felt like I just had to trust what he was saying, and it felt very scary, and it just didn't feel like the right decision. I just knew I wasn't going to book in. I felt like I needed to take a couple of days to think about it, and for me that was a sign that he wasn't the right one to book in with. So then I decided to reach out to Dr. Zachariah and book in a consultation with him. We were able to do it over FaceTime. They were so accommodating and just chill and lovely. Just the second that I spoke to him, I don't know, I just knew that he was the right surgeon to go with. I think that's the thing, like, you have to have consultations. It is going to cost you a little bit more money to have multiple consultations because you do have to pay for it, and it is separate to your overall like fee and cost of your nose, but I just think it's so worth it. Like, it is absolutely worth it. If it means that you have to save up a bit more money, I recommend it, because I cannot imagine if I went with that first surgeon. Like, I just don't think it would have been right, and I don't think I would have been happy with it. I felt so comfortable with Dr. Zachariah. I felt like he was much more personable, and I feel like our personalities just went together a lot better, which might seem silly and like it's not something to worry about when you're getting a surgery, but I feel like it absolutely is. You need to feel really comfortable and at ease and just like taken care of by your surgeon. Feel like they get you and just totally relate to what, like, the outcome that you're looking for. The second that he did my images and showed me, he was like, how do you feel about that? And I was like, you have literally just taken exactly what I edit on my phone and brought it to real life. Because like, I had been playing around with Facetune to see like what kind of nose I might want, the things I want to change, just like moving them to see like what it might look like. He literally made it exactly the same. Like, I don't know, I'm sorry about Watson, but yeah, I don't know what else to say. I just feel like it was so worth it. I feel like I got really lucky just having 2 consultations and knowing the second time around that he was the right one. But if I didn't vibe with him, I would have just gone to another one and kept searching until I found someone that I did vibe with. One of my friends went to 3 consultations, and she ended up looking at all the photos that they did and then deciding, having gone to all of them, put it all into a pool, pros and cons, and decided from there, if that makes sense. I think I just know if I vibe with someone or if I don't. I think Dr. Zachariah just made me feel really comfortable with the idea of filming the entire experience. He is a very online surgeon. He does like a lot of Australian celebrities and reality stars and influencers. So I had a lot of like noses to look at for before and afters, and just like a lot of people to talk to about it. And I just found that really relatable as well. I don't know, the idea of him was just very like open and non-judgmental. Definitely recommend doing multiple consultations with doctors and just to find the right one for you. Don't go off the price of it. Go off like which surgeon feels the best. If you have to save up a little bit more, just do it. It's your face. It's so not worth taking the risk of going to the person who's cheaper just because they're cheaper. Next one is, how did you choose your doctor plus research doctors? I feel like I just kind of chucked those answers into one. The doctors that I decided between are ones that friends had gone to. That's kind of like how I based like my decision. I knew friends that had really good experiences, so I wanted to look into those two first. I couldn't really find much else on other doctors, if I'm honest. There is a website called Real Self, I think it is. I'll link it down below. But basically any kind of surgery you're thinking of having, you can go on there and people leave a bunch of reviews about all their experiences they've had, their surgeries, who they went with, and all that sort of stuff. And it's kind of just like a forum, Reddit sort of style. I think even doctors reply on there. I started looking into that like just before I booked in with Dr. Zachariah, and then once I had my consultation, I just didn't look on the website anymore because I just had decided that I liked him. Aside from that, I looked up vlogs. I tried to find vlogs of other people going to the doctors I was interested in. I also just tried to see anyone else going to different surgeons in Sydney, which I didn't really find much of. Even just like Australia in general. Like if I had to fly to a different state, I would have, ideally Sydney, but I just couldn't really find much of anything, which is like a big reason why I wanted to film my experience and like put the doctor's name there, because it just makes it so much easier for people to research and look into it. Because yeah, there really wasn't many Australian vlogs when I was researching. And the last question, the juiciest one of all, everyone always wants to know, how much did it cost? It just really depends what you get done. I'm not going to say what I paid because I just think it's personal, and I feel like you also just need to reach out to the doctor yourself. Most people just want to know how much I paid for the tea, like they're just nosy. But I feel like if you actually want to go and get a nose job, you will call up the surgeon and you'll get a consultation and actually like research into it. Do you know what I mean? I don't want people being discouraged by the price on whether they want to go to someone or not. I think it's like important. I think like if you're actually contemplating going and getting one, you'll look into the price yourself. Does that make sense? It shouldn't be a reason why you go with a doctor is the price. But I will give you a ballpark of pricing, not just with my surgeon, but with any surgeon. Nose jobs can be in the ballpark between $10,000 and $30,000. Depends where you go, and it depends what you're getting done. I will say mine was not $30,000, but I know a few friends of mine that their nose jobs were like several K higher than mine, just based on having to have breathing work done or just their surgeons being a little bit more expensive. I will say the biggest benefit of going with Dr. Zachariah, and it was very appealing, is that they do offer payment plans. I'll leave a link to the website, like where it is on there, but it's through like a plastic surgery loan kind of company. So basically you get like a loan and you can just pay it off in installments. I'm not sure, don't quote me, but I know a lot of places now offer like zip pay, afterpay, things like that. Some kind of post-pay sort of plan where you can pay things off. And I was looking into those kind of options as well when I was looking at my nose job. I was prepared to pay for it outright, but I was also looking into paying in installments. I know price is a big factor when it comes to things like this, but personally I think that you should try and save up for a surgery like this, or you should look into payment plans. Make sure you're financially in a position to do it. If you're not, please don't go ahead with committing yourself to a big surgery and have no way to pay for it. That honestly stresses me so much, and I just would not want that for anyone. I waited a very long time till I was in a financially stable position to be able to do this. And even now, I'm like, my funds took a big hit getting this nose job. I don't regret it, but it was a big hit financially. It's a lot of money and it's a lot to save up for, and it's really important to just make sure that you're in a position to part with that money, whether you get a payment plan or you pay for it all up front, whichever you do. Anyway guys, that is it for this video. Those are all my questions. That was a lot longer than I thought it was going to be. I thought I would be able to get my makeup done while answering those questions casually, and I feel like half was getting ready and half was me already ready. Really hope that you guys enjoyed it. Hopefully I answered everything. Hopefully I gave you enough info. But yeah, thank you guys so much for watching, and I will see you in my next one.